The pandemic has really pushed the free clinics from the standpoint that there's much higher patient demand for their services. That's because of the economic fallout, the higher jobless rate, and the fact that a lot of those people, unfortunately, that are newly unemployed don't have health insurance and don't qualify for Medicaid. So the clinics, as a result, are seeing as high as a 20% increase in patient volume. The clinics have been changed in a very, I think, lasting way by the pandemic. And by that I mean that they have had to find ways to reach their patients where their patients are. They can't expect their patients to be able to come in as easily. A lot of the patients are scared to do so, of course. Some of them suffer from chronic conditions and are at high risk of contracting COVID-19. So the clinics have gone out to those patients virtually in many cases, by phone, by video, by devices that remotely monitor their conditions and are internet enabled. They have done food deliveries to patients' homes. They have tried where they could to provide transportation. So they're doing everything they can to meet patients where they are. One major example of how our clinics have redoubled their efforts and responded to the pandemic with respect to taking care of these most vulnerable populations is that the governor of Virginia came to us, to our association, and essentially asked us how we could help the state address these marginalized populations and their risk of coming down with COVID-19. And because our clinics are the trusted source for care by these populations and have been for years, we teamed up with the state to deliver COVID-19 testing to these patients at our clinic sites. There is no other state in the United States right now that has as many free clinics providing testing for marginalized populations.